So what do we have planned in terms of future events? Well, we're going to kick off in a few weeks' time with a Healthy South Asian Cooking Seminar. We plan on having networking events every quarter. We're hoping to have a Healthy Heart Forum in the fall, and there's talk of a gala fundraiser sometime around the end of the year. And what could become our flagship event is a South Asian Health Fair that we're thinking about in the summer of 2009. There's a lot of excitement building around that one. A lot of work, but really a tremendous amount of excitement around that. Speaking of excitement, hope you're beginning to feel excited. We've given you a few teasers before you came today around what SAPNA was all about. So now you know a bit more. So I hope you're beginning to feel excited and engaged with the SAPNA vision. You know, one of my philosophies in life is that I always try to leave anything that I'm involved with, be it an organization, be it a team, in a better place than when I arrived. So please help me. Let's make the health of South Asians in Canada better in the future than it is today. So I very much hope you'll join us on the SAPNA journey to achieve our dream. Thank you very much.
It's that British accent. Everything sounds better when he speaks. All right, somebody else who has a very lengthy bio, deserving of course. I'd like to introduce our guest speaker for tonight. And I like to bring this up to a little bit shorter than me, Dr. Rav. We're on a first name basis now. Well, she brings extraordinary experience, passion and perspective to her role as the Member of Parliament for Brampton Springdale in Canada's Parliament. As a community activist, doctor, and entrepreneur, she is one of the leading progressive voices in Parliament and works tirelessly in Parliament on behalf of those that struggle to be heard. She made history in 2004 as the first South Asian woman to be elected to federal Parliament in the Western world and was subsequently re-elected on January 23, 2006 by the support of her constituents. She is the youngest woman in Canadian Parliament and currently serves as the official opposition critic for social development, as well as vice chair of the Standing Committee for Human Resources and Social Development. There's more. As a doctor and an owner of multidisciplinary health care clinics prior to seeking public office, she has witnessed firsthand the complexities and the challenges of Canada's health system, especially those faced by patients and frontline healthcare providers. It is with this first-hand knowledge and insight that our guest speaker has been able to contribute to her former role as a critic for health for the official opposition and as vice chair for the Standing Committee on Health. It's with great pleasure that I introduce our guest speaker for tonight, Dr. Ruby Dhalla.
Bollywood music too is kind of exciting. Thank you very much, Pooja, for those very kind words. I thought by the time she read my bio, Dr. Kumar said I only had about 10 minutes to speak, so I thought my time was going to be up. So thankfully it ended a little bit sooner. It's a pleasure and an honor to be here with so many distinguished people from our community and Canadians with you today. It was really a privilege for myself to be asked by Dr. Kumar to come and say a few words to such distinguished individuals like yourself. And I remember when I was first elected to the House of Commons and asked to sit on the Committee for Health in Parliament, the Minister of Health at that time, from our very own community, Minister Ujjal Desange, came to me and he said, you know, the department is a little bit worried. And I said, what are they worried about? He said, well, the last time there were 4 medical doctors on the Committee for Health, they ended up screwing everything up. And I said, okay. And he said, this time there's 4 chiropractors on the committee. And I said, that's great. And I said, as a chiropractor, I said, it's a great idea to have 4 chiropractors. And he says, no, last time the medical doctors were there and they screwed everything up. And I said, don't worry. I said, make sure you tell them we're going to straighten everything out. And I'm sure with all of you today, we're going to be able to spice things up when it comes to healthcare policy in Canada. As I look around the room, there's a tremendous sense of pride. And having had the opportunity to mix and mingle with some of you before, I was overcome with, again, a sense of pride to see the achievements of so many of you. You know, when I have a chance to travel across the country and throughout the world, I talk about the achievements of our community, of some of those very same people that are in this room with a great sense of pride of not only being a Canadian, but being from the South Asian community. We only have to go back to the year of 1913, many, many years ago, when we had a shipload of people come from India, arrive in Vancouver, and not allow to be disembarked or enter into Canada. And many of those fellow Indian people were kept on that ship for a period of 2 months without food and without water. And many of you may be wondering, why am I telling this story? After 2 months of being kept on that ship without food and without water, that ship was forced to return to India. And upon arrival in India, many of those passengers were either killed or imprisoned. And I look at our success in 2008 as Canadians, as South Asians, and realize how far we have come. And for all of that, I think you deserve a tremendous, tremendous round of applause.